What's going on, guys? So I got some questions on Instagram, and so I'm going to address them here, just kind of recap them and review them and give you guys a little more insight, a little more detail. So I got a question on hip labrum tears, and it asks, is it possible to thrive in BJJ without surgically repairing them? So yeah, so let's talk about that. So the labrum in your hip, kind of like a shoulder, it's a cartilage. It's kind of helps. It sits in the socket and the capsule, and it helps kind of keep that hip in good position. Also provides some cushioning in there. You can get tears, from various things. It could be, impact injury, getting your leg positioned incorrectly. So there's a lot of, reasons why you may get injured. Now, here's the thing with hip labrum injuries. You want to first of all make sure you have the proper diagnosis. You want to make sure you're diagnosed, go see your physician, make sure that, it is essentially the injury that you think you have. Now, the goal with a hip labrum injury, if it's non-surgical, if the doctor's like, we don't need to do surgery or we're going to try to avoid it, you want to try to gradually and comfortably increase your hip range of motion. So whether it's stretching the hip, if you're doing like controlled articular rotations or joint circles, you have to be kind of mindful and careful that you're not causing any pain or pinching or irritation in there. So getting your range of motion back to normal is number one, and then also strengthening the hip and the surrounding tissue, the trunk, the core, strengthening around the hip is very vital and very important. Doing those two things, making sure you have good range of motion and good strength, and then gradually transitioning back to Jiu-Jitsu and doing a little bit of trial and error, meaning you're trying to really make sure that you figure out which positions are comfortable for you to do and which ones are not, and avoid those, because it could be one side. You may play a half guard, and one side of half guard may feel better than the other. So those are options you can look at, but that's essentially it. There's not one way to do it. You have to listen to your body, be very diligent and mindful about it. So this question is, X-ray said I have swelling on the bones by my knee. What should I do for that? So as far as like having irritation or swelling in the knee or surrounding the knee, you want to try to make sure you get some movement in the area. Now you want to ensure that your movement's not painful, but again, you want to make sure that you try to create range of motion, because blood flow and circulation, that can help promote the healing process. Again, it just depends on what irritates and what doesn't irritate that area. So if you have a knee, or even like a bursitis, for example, so like maybe around the kneecap, so bursa is like a fluid-filled sac that it kind of helps with cushioning, but it also helps with friction, but it can get inflamed. Say it's like around the kneecap, you may want to avoid anything where you do high impact on the knee, where you're hitting your knee on the ground. Maybe limit your takedowns or adjust the type of takedowns you do. I know not everybody's a fan of pulling guard, but that might be a situation where you pull guard, or you don't focus on the standing aspect for a bit. Avoid anything where you're kneeling or on the knees, so try to play a bottom game or a position where maybe if like you're standing passing, that might be better than like low passing, or if you're somewhere where you're kneeling on your knees. So that's kind of some ways to adjust and work around it. But again, range of motion, if there's any areas in the musculature that's tight, or if you feel like there's some inherent weakness, it's good to strengthen. I'm always a big fan of strengthening squats, deadlifts. I love single leg exercises like single leg RDLs, or even lunge sequences, as long as that's not adversely affecting your knee. So that's kind of the key there. You have to figure out what works for you and try to limit irritation and work your way back slowly. So the question of knee bursitis, will it go away on its own? Can you train around it? We just kind of discussed that as well. I kind of bundled those questions together. Yeah, so if you have bursitis or like inflammation, that kneecap area, again, avoid anything where you're doing heavy kneeling or putting pressure or hitting that knee on the ground. That is an instance where I will wear some knee braces, recommend some knee braces, because they usually have like a kind of like a donut around the kneecap, a little cushioning, and that can help distribute some of the impact that you may have with training. So that's an instance where I would recommend a knee brace that has some cushioning around the kneecap area. So, but it is possible to train around it. You have to, again, be the judge and kind of figure out what works for you. So this question says, my hips stay clicking and just not a lot of mobility. I don't know if that matters. I'm 17. So the clicking doesn't really matter. To me personally, like I usually, the clients I work with, if you have a clicking in your hip or a joint, as long as it's not painful, I don't see much issue with it. Again, you don't want to promote the clicking. You want to try to make sure you avoid clicking if you can, but sometimes it's unavoidable. Your joint will just click. Again, range of motion wise, look at the joint itself and then the surrounding tissue. Focus on joint circles or controlled articular rotations. I'll send a link down below of the CARS routine, which is for your whole body, but you can do that one as long as it's comfortable and you're not getting any pain. Again, strengthening the area, strengthening the hip is very important, I think, to protect the hips. One of the most important things you can do for injury prevention is strengthening the tissue, strengthening the area in the joint. So, strengthen. Neck exercises for rehab, injury prevention. So, great question. I think that's an area where a lot of people don't train the neck specifically for strengthening. Neck strengthening is very important. There's a lot of good research out there as far as like strengthening the neck can help prevent injury. It can help preventing concussions if you're like in a combat sport or even football or contact sport. But also strengthening can even help, with the range of motion and just the overall function of your neck. So I think strengthening is very important. Again, begin with range of motion exercises. Try to create full range of motion. So neck, controlled articular rotations, doing neck joint circles is excellent. And then, work on strengthening. I'm playing around with the iron neck, and I'll have a video for you guys shortly on that. So the iron neck is something I've been working with. I really like it, actually. It definitely is different than anything I've used, but I'll send you guys some more info on that. But you can even do gentle isometric, meaning you have like a towel and you work on pressing all different directions, isometrically pressing, which just means you're not really moving your head. You're kind of putting pressure into a towel or a ball or something like that, just to activate those muscles. And I think that can actually be a good start. But again, limit anything that's painful as always. Avoid anything like that. But create range of motion, increase the strength. You can always stretch some of that tissue. And also, don't focus just on the neck. Focus on the pecs and the mid-back as well, strengthening the mid-back, possibly stretching the pecs. That can help positioning of your head and neck, help with creating some more balance in the body. Pulled psoas. I'm not squatting or rolling. I'm foam rolling and stretching. Anything else? First of all, psoas is a hip flexor, so it actually brings your knee to your chest, so flexes the hip. Again, get a proper diagnosis, number one, but like a lot of times when you have a pulled muscle, or if it is a pulled psoas, it's not always that the muscle needs to be stretched. I would encourage you to look at the surrounding tissue, look at, maybe if you are stretching the psoas or the front of the hip and that's helpful, look at strengthening the glutes, strengthening the posterior chain, the hamstrings, the glutes, the outer hips, all that, and even work on gently strengthening the psoas or the hip flexor musculature. And again, you can begin with isometric, meaning you're just pressing against your hand or something just to provide a little activation. And isometrics actually where you're pressing against them, but you're not actually elongating or shortening the muscle. You're just pressing into like a static force. That can actually be helpful in pain relief and helpful in recovery and actually building some strength. So strengthening is important if you can tolerate. I would always encourage strengthening. Just if you have a pulled psoas muscle or a hip flexor, it doesn't always mean it needs to be stretched. Look at the body as a whole, look at the surrounding areas, and check out some strengthening. That may help. So here's a great one, guys. Is it possible to train with a small meniscus tear? My doctor and PT advise against surgery. Absolutely. A lot of meniscus tears are not surgical, and they can be treated conservatively with rehab, physical therapy, strengthening, things like that. Again, when you're looking at the meniscus, you're looking at where the tear is and the type of tear you have. Again, blood supply and healing is not the best in the meniscus. And again, it depends on where the tear is. But a lot of times people can get away with just rehab, just conservative measures. It can be very helpful. Again, you're trying to regain range of motion, get your strength back in the knee, the hip, work on squats, deadlifts, all those things when you're ready. Even working on balance, working on hip rotation, single leg balance, things like that that can kind of help alleviate some torque or torsion on that knee, because a lot of times the meniscus can tear with a rotational kind of injury. So be mindful of kind of getting your foot in precarious positions or twisting pressures on the foot, because that can impact the knee. But absolutely you can recover. I've got a series, I had a friend that had a meniscus tear, a training partner, and he actually ended up having surgery, but I've got actually like a protocol that I took him through. You can check that out. It's a meniscus injury recovery vlog. That's down there on the channel. You can check that out just to get some ideas. But again, get back to training very slowly. Make sure you have the approval of your physician or your physical therapist when you get back, and incorporate drilling first, solo drilling, partner drilling, then positional rolling, and then off to full rolling as you feel comfortable. Again, there's not a set time. Everybody's different on that, so just take your time and listen to your body. But again, is it possible to train with a small meniscus tear? Absolutely. You just have to be mindful of the positioning you're in. So you can definitely train. Be mindful, communicate with your partners, let them know what you're dealing with. I think you can maybe work your way around it for sure. Quick question here, or quick answer. Do you recommend seeing a chiropractor? Depends. Depends on the chiropractor. Depends on what they do. There's a lot of good chiropractors out there. There's some not great ones. Same thing with any profession. Good docs, bad docs. Good PTs, bad PTs. See what they do. See if they understand what your goals are, if they can work with you to achieve those goals. But chiropractic, again, there's a variability of how chiropractors treat. Some will just kind of mobilize or just pop your back. Some will give you exercises. It just really depends on the but yeah, it depends on the chiropractor. I wouldn't just say that all chiropractors are bad or all of them are good. It depends on the practitioner themselves. I'm always willing to learn from anyone, and always willing to recommend it. I mean, I think everyone's got value of something that they can provide. So yeah, I think you can definitely find a good chiropractor that'll work for you. So guys, that's it for this set of Instagram questions. I've got a few more I'll incorporate into another video. Hopefully they're helpful. If you have more questions for me, shoot me some comments down below with what you want to know about, what you want to learn, or if there's other videos you want to see me make. I'll do Instagram questions from time to time. So follow me there, the Jiu-Jitsu Therapist, and see you next time.